everyone. I want to first just thank Mayor Bowser for those empowering words, for inspiring us, and for serving our nation's capital. As a proud member of the board of All In Together, and also as a scientist myself who works in the health space, it's my pleasure to welcome our first panel of the day, which is focused on maternal health and health equity. The health and well-being of Black women could not be more central to our ability to thrive. In the U.S., Black women's health outcomes, especially with respect to maternal health, are quite dire. So in one example, Black women are 3 times as likely to die from pregnancy-related causes as white women. And so today's speakers are driving critical innovation and change to address those disparities. Dr. Joia Crear-Perry is the founder and president of the advocacy, policy, and training organization, the National Birth Equity Collaborative. She's a leading physician, policy expert, and advocate for transformational justice, identifying and challenging racism as a root cause of health inequities. Latham Thomas is a maternal health advocate on a mission to help women reclaim birth. She's an author and founder of Mama Glow, a pioneering global maternal health and education platform, which also provides doula services throughout fertility, pregnancy, birth, and postpartum. Moderating this important panel is All In Together Executive Board member Celeste Warren, who is the leader of Merck's Global Diversity and Inclusion Center of Excellence. Please welcome Celeste, Latham, and Dr. Crear-Perry to the stage.
Okay, this is on, and the counter has already started. Well, welcome everyone to this event, and we're going to go ahead and get started real quickly. We know that maternal health is extremely, extremely important to all of us, our loved ones, friends, colleagues that we know in our communities. And so I want to ask you both, and I'll start with you first, Joia. Is Joia or Dr. Perry? Joia.
Joia. It's fine. I've been running from doctor since I got that degree. So.
Yeah. Well, Joia, I'll start with you. Where did your journey begin on this quest?
You know, people often ask about an origin story, and for most people, for Black women specifically, it's with ourselves. We are usually fighting for something that we're trying to fix because of our own existence. So I have 3 specific birth stories. 3 different children who had very different existences. The first child that I had, though, and the reason that I started the National Birth Equity Collaborative is because my son was born, he only weighed about 1 pound. And I was in medical school. I was intending to be pregnant. I was married. I had none of the risk. I didn't even have liquor at my home back then, right? And so the risk factor that I had as a Black woman who was only 25 years old was being Black. And that made no biological sense. It made no sense at all. There's no Black gene, there's no Black kidneys, there's no Black pelvis, but yet my only risk factor was being Black. So really unlearning the eugenics and the white supremacy that I was taught in medical school, and the eugenics and white supremacy that all of you have been taught in your textbooks is really important. So that's the journey that I'm still on, and the journey of the work that we do at the National Birth Equity Collaborative.
Latham, tell us about your story.
So I had an experience, was on the other side of the spectrum. My son is 18. I was pregnant in New York City and had the opportunity to deliver in a birth center, a freestanding birth center, so I birthed with midwives. And it was an experience of autonomy over my body, of body sovereignty, of choice, and also a model for what care should really look like. And so the midwifery model of care really centers the birthing person, the mother, the family around them, and then the providers come outside of that. And in the hospital setting, we see that the physician is at the center. And so it was a completely different experience. And at the end of that, I birthed in the birth center. They give you your baby, you walk home like 6 hours later, like, where are the grown-ups? And then, but because of that, because of how humane, how beautiful, how transformative it was, 20 minutes after my son was born, I said, oh, I have to protect this experience for other people. And I knew that would be, I didn't know what it would look like, but I knew that would be my quest.
Joy, this question is for you.
Okay, I'm ready. I'm a little rusty. It's been, it's been a pandemic. I don't know if y'all noticed.
I have to read this. I have to read this quote from the senator from the Louisiana.
Oh, my buddy! I already know where we're going. I'm excited.
He said about a third of our population is African American. African Americans have a higher incident of maternal mortality. So if you correct our population for race, we're not as much of an outlier as we'd otherwise appear. That was from the Honorable Louisiana Senator Bill Cassidy.
Who's a physician.
Yes.
Who's a board-certified gastroenterologist.
Tell me what your response was to that.
That he learned the same eugenics, white supremacy, and patriarchy that I learned in medical school at the Louisiana State University. I took classes that people like him taught in where we learned that there was 3 biological races, Mongoloid, Caucasoid, and Negroid. So I'm not surprised that he's still saying these words, although, unlike him, I've actually unlearned that. So I spent a lot of time saying, well, why would we teach that? Why would we have a class, instead of being named embryology, a class named human prenatal development? So the truth is, the reason that Latham had a beautiful experience as a black woman in New York City is because the people they were allowed to have a birth center. Ask him how many birth centers they allowed through when he was a state senator in the great state of Louisiana. Ask him how much they invest in expanding Medicaid when he was a state senator in the great state of Louisiana. Ask him what his commitment is as a public health physician who worked and trained at Louisiana State University at Charity Hospital to actually helping ensure that people have the birth experience that you had. And then when he actually looked at data, so in New York City, black women are 8 to 12 times more likely to die in childbirth than their white counterparts. And in Louisiana, it's that 2 to 3 that y'all keep talking about. The reason is not because we're so much worse. The black women are, the difference is when you invest in people like you can do in New York City, and you disinvest in people like the choices that Bill Cassidy does by blaming and shaming us for personal behavior. You have white women who are dying in in Louisiana, that if they lived in New York, guess what? They would live. So in fact, what he's doing is lying, because he knows that. He can read. He's making a choice, a political choice, to decide that he does not know how to read epidemiology. We took these same classes. He knows that white women are dying. There are a lot of white women, if they lived in New York, they could go to a nice hospital. If they live in Louisiana, they are dying, and they have no access to Medicaid expansion. They have it now, but they don't have a lot of care that they shouldn't have. They don't have doulas. There's a lot not happening, and that was really their political choice.
Well said. Latham, data suggests poor access to care, mistrust of the healthcare system on the part of black women, and implicit bias among providers are critical in black maternal health disparities. We know that when we report something, sometimes it goes and no one hears it, they don't understand it, it's dismissed or unheard. Can you share how your work is addressing those structural barriers?
Well, I think it's important to outline that those experiences have been normalized. They have been centered and also rewarded in medical spaces. And so what we're finding is not only are people, we have data, like we don't need more data. Black women are the living people and share their lived experiences. That's the data, right? So we don't really need to do more studies. We actually need to listen to what people want in terms of outcomes. And so in response, a lot of folks are talking, not just the birthing people and the mothers, but we're also hearing from practitioners inside medical spaces like nurses. We're also hearing from doulas who are going in and saying this environment is also hostile, right? And so if you go in to support someone along their birth experience and you're met with challenge, you can't get in, you have to show your papers. It's this sort of culture of dismissiveness, divisiveness, but also mistrust. Then how do you support someone to have the best experience possible? How do you help them advocate for themselves? I think the other misunderstanding that's really pervasive is the idea that you should be actually advocating for yourself in this process. Right. You should be able to actually birth. Right. You shouldn't be advocating. You should be birthing, right?
Fighting the power even when we have the baby.
Right. So the fact that you're asking black women to swim upstream, essentially, right, in the birthing process is really challenging, but also there are health implications for that. So what we're doing at Mama Glow and the Mama Glow Foundation is really primarily educating doulas who have trauma-informed skill sets so they can enter into any birth space to support people who are marginalized. And this is, when we're talking about white supremacy, we're talking about white supremacist patriarchy that includes homophobia, transphobia, fat phobia, ableism, ageism, right? All of these facets, right? And racism is obviously at the core of that. And so everybody who shows up that's not white, cis, heterosexual male is also having an experience that is marginalized. And so the doulas show up with skill sets to support people along the birthing experience. They're also folks who help to vision care that is respectful, that is patient-centric, that is also just, it should feel regenerative. You should feel on the other side of this empowered, right, and dignified. And we also have to imagine and live into what we want to create. And so part of it is actively divesting in institutions that are not providing the best care possible and investing in what we want to see and model for. And so part of what we do also is provide access to midwifery support and also midwifery education, which is also something that we need to invest in because, you know, there's not, all the physicians are not like her, right? We need more physicians, but we also need black physicians, but we also need more midwives, right? The country's foundation for maternal health was built on midwifery, and it was actually built on the backs of black grand midwives who did this work. And so now we need more of them because we have about 37,000 OBGYNs and we have 14,000 midwives. And what we saw in COVID was that people wanted to deliver with midwives outside of the hospital, especially folks who had healthy trajectories for their pregnancy. They were great candidates for home births or out-of-hospital birth or birth center births. And we didn't have the midwives to support them. And we didn't have black midwives to support them. So it's really important now to actively invest in education for midwifery support so that people can work inside their communities. You don't have to go really far. If you are seeking care, you shouldn't have to walk more than 3 blocks to seek care. And so we have to reduce the barriers to that, but also the barriers for education. And so one of the things we're doing in New York City is working with some of the local institutions to actually build up the midwifery workforce. We're also working with some Ivy League universities on our doula work to get folks who are on the trajectory to work in medical systems because, by the way, I teach them some of the first and second year med students. They don't know the difference between a midwife and a doula. We got to fix that. So we're working to get the kids in early who are going to be the chiefs of the hospitals, the heads of OB, and who will shift the culture internally inside these institutions by also teaching them the pathway of doula work so they can have those soft skills that are really important.
Excellent. So let's keep exploring the answers. What are some of the answers that we could be doing? One of the things that I've learned from my colleague at Merck, Marianne Attabet, is around the work that we need to be doing. And so she leads our Merck for Mothers initiative. And she has taught me that it's got to be partnerships. It's got to be partnerships with people in the communities and agencies that are on the ground doing the work. You have to establish the trust. You need grants, right? And so we have grants that we offer, the Safer Childbirth Cities grants. Yeah. So what are some other things that we could be doing as a community in the ecosystem to move this forward?
Yeah, I see Dr. Marianne is one of my best friends. She's so brilliant, and she always reminds us that this is not just a responsibility of government.
Thank you.
So I was really honored to be here today with you all who are the captains of industry, because you have an obligation to your actual staff. What workforce are you building? What partnerships are you building with community, with your organizations at P&G, at Merck? How are you really leaning into this idea of justice and joy for your actual employees who are capable of birth? That's a start you all could do today. So first is looking within, your policies within, and what you all are doing for each other to collectively. And then when you talk about government in New York, I talked about birth stories. My first birth story was a normal vaginal delivery in an operating room, because in New York City, people who are poor and low income are marginalized as to how they can even have birth. They're only allowed one person in the room, and that's the same thing that happens in the great state that my senator has as well. And so I had to pick between my mother and my husband at the time. Right? And so those kind of choices, a community could say, we want community accountability for what happens in hospitals and the beautiful work that Latham is doing in New York. So you cannot have a person who is being harmed inside of a hospital then try to have redress from a person who also has little power. All right? So we call patient advocacy. Guess what the patient advocate is in the hospital? One of the lowest power positions in the hospital. They make the least amount of money. So they're going to, fight the CEO?
Right.
What would it look like to create an accountability in a community? What would it look like to say, hey, hospital that's in the Bronx, or hey, hospital that's in Bogalusa, Louisiana, we're not going to call the patient advocate who's the lowest paid person in the hospital and expect them to advocate for the patient, because if we understand power, because I want to be a community organizer. I'm an OB/GYN who wants to be a community organizer. If you understand,
she already is one.
If you understand power, that is fraught. No one's that person wants to get paid. They have to go home and feed their family too, and they probably don't have any paid leave or equal pay because there's been a political choice that they're politicians as well, right? So we need to create structures where we have community accountability. If we don't do it soon, you know who's coming? The lawyers. I'm an OB/GYN, trust me, I've been sued a gazillion times. We have a whole system that's fraught, built upon malpractice in this country.
That's right.
And it is horrible. We're not going to malpractice our way out of this. We're not going to have, I've had states' attorneys already calling me, asking me, how do I sue hospitals for this maternal mortality stuff? So if y'all want to get it together, we need to have community accountability. We can have transformational justice where we agree that the community has the power, and that the community says you're doing something wrong. You're going to actually listen to what the community says and build more birth centers and allow for more room for midwifery and home births, because that's the choice of the people.
Let the church say amen. I would say, first of all, and I love Dr. Perry. She has been an advisor to Mama Glow for so long, and so we love her and the work so much, so thank you. I would also say, too, that, to add on thinking about investing in the people, we have the workforce in our communities, right? And so I hear workforce development. It's like, no, we have the workforce. So like you were saying, Celeste, the funding, right, needs to come. And so I think for Black female-led enterprise, Black female-led organizations that are already problem solving, fund them, bring the resources there. The other thing I would say is in the city of New York, Mayor Adams launched the Citywide Doula Initiative, which was an expansion of an existing program that allowed for people who were already in community, who already had relationships with their communities to provide doula services inside. And so Mama Glow Foundation is one of 7 organizations that's providing doula services for 33 zip codes across New York City. Thank you. And as a result of that, though, people are inside of their communities walking up to folks like, hey, I'm here if you need me. And so we have a pulse on what's happening in terms of health outcomes because folks are in relationship with these people already. Also, they are paying people to do the training. So understanding that it is an investment in the workforce, but also that people can't just take off. They have children, they have bills to pay. So if they're going to build a workforce, invest in the workforce by also making the education available, but also paying them to get the education. So we think the compensation piece is great. And also paying people, I don't like this living wage, a thriving wage to live. Yes. You cannot pay people I feel like people calculate to see what's enough to keep people halfway off the street, but it's what is this calculus, right? Pay people well. People will, if they can afford to live and to eat and to thrive and to take care of their families, they're going to be able to pour a lot into the work that they do. So we need to also invest in building infrastructure that supports people, not marginalizing them. And I love what the mayor said about making sure that we enfranchise people. This is really important, especially in the economy that we have right now. We have so much resource, and so it's important to uplift the resources that are in the community already and build structure around that and support folks to thrive. And so, I know that we can do it. Right. We do need the support, though, but we can do it.
Well, I just want to say thank you. Thank you both for being here at Black Women Lead. You are role models. You are heroes,
okay,
right? and leading the way. So thank you so much.
Thank you, too.